Well, hey there, and welcome to our channel. So in today's video, we're going to be talking about how to pay for Medicare when you're living on a fixed income. Now, Medicare was, of course, designed as a low-cost option for senior citizens for healthcare. However, even though it was designed as low cost, quite frankly, it can still be a financial burden to many. So in today's video, we're going to be talking about some options that can help you pay for Medicare if you're living on a fixed income. Stay tuned. Welcome back and welcome to our channel. So my name is Sarah and I'm here today with iHealthBrokers. Now we release these videos on a weekly basis that are designed to educate and inform people about Medicare and health insurance in general. We really want to demystify things and of course help you save money. So we do release these videos on a weekly basis, so please make sure to like this video and subscribe as well to stay up to date. Now at iHealthBrokers, we are licensed health insurance brokers. We're licensed in all 50 states and with over 200 carriers. So if you have any questions whatsoever, please feel free to leave them in the comments below, and you can rest assured that you will be getting expert advice. You can also reach us here at iHealthBrokers at 888-410-0344. There is absolutely no charge for our services. So if you have any questions, please feel free to give us a call and we will do our best to help. So like I said before, today we're going to be talking about how to pay for Medicare if you're on a fixed income. And luckily, there are quite a few options. If you're living on a fixed income, the first option that you may want to look into is Medicaid. So Medicaid eligibility is determined by the Federal Poverty Guide, your household size, and your state. So if you're living on a fixed income, it may be something that you want to look into. Now again, I want to stress that your state is very, very important here, because even though it is a federally funded program, certain states have more lenient criteria than others. So you definitely want to contact your state's Medicaid office to find out exactly what those eligibility criteria are. You may also become eligible for Medicaid through disability. Now, if you are eligible for Medicaid, some people don't know that you can actually use Medicaid in conjunction with Medicare. And you can enroll in a DSNP, which is a dual eligibility special needs plan. Now, these are a great option. DSNPs will afford you the full benefits of Medicaid, plus Medicare Part A, which is your hospital insurance, Medicare Part B, which is your outpatient insurance, and they'll provide you prescription drug coverage as well. Now, in addition to all of those, because these are a Medicare Advantage plan, which is also known as Medicare Part C, very often there's going to be additional fringe benefits as well. These would be things like dental, vision, hearing, and more. And DSNPs are extremely competitive on the carrier side, which is great news for you. Because these are offered by private carriers, they do compete for your business. And how they compete is with those additional fringe benefits. So in addition to some of the basic benefits that we just discussed, some of these plans offer things like transportation to and from your appointments and even meal services. So they really are a great option. Now, if you're interested in learning more about DSNPs, we have a video that's dedicated entirely to them, and I'm going to put that link in the description below. Another option that you may want to look into are Medicare savings programs. Now, eligibility for these is determined by your income and your assets. So if you're living on a fixed income, this may be an option for you. And actually, some of these programs even work in conjunction with DSNPs, so you may be able to take advantage of two programs, which is pretty good news. There are 4 types. Now, bear with me because I'm going to throw some acronyms at you. There is the QMB, which is the Qualified Medicare Beneficiary, the SLMB, which is the Special Low Income Medicare Beneficiary, the QI, which is the Qualified Individual, and the QDWI, which is the Qualified Disabled Working Individual program. Now, all of these are slightly different. They have different criteria, and different benefits, and they work a little bit differently. So if you want to figure out exactly which plan might be right for you, we have a video that's dedicated entirely to Medicare savings programs. I'm not going to go into full detail today in this video. But what you do need to know is, like I said before, criteria for eligibility is going to be determined by your income, your monthly income that is, and your assets. So based on your income and your assets, you may be eligible for different programs. Also, based on your needs, you may be eligible for different programs. But in general, they are designed to help you pay for your Medicare premiums. That would be Medicare Part A, if you do need help paying for that. For many people, it's free. You may also be able to receive help paying for Medicare Part B. That would be your outpatient insurance, and for most people there is a premium for Medicare Part B. And most of these programs will actually enroll you in extra help, which is going to help you pay for Medicare Part D, which is your prescription drug coverage. Now, one more thing I do want to mention is that some of these programs are actually first come, first serve. So if you think you might be eligible, don't let the grass grow under your feet. Okay, so let's talk about prescription drug coverage. Now, as we know, prescription drug coverage is very, very important. Now, if you're able to enroll in a D-SNP, then you're going to have prescription drug coverage. And actually, most of the Medicare savings programs will automatically enroll you in Extra Help, which is a program that's designed to help you pay for Medicare Part D. However, even if you're not automatically enrolled or you're not enrolled in a Medicare savings program of any type, you can enroll on your own. You just have to fill out a special form, and I'm going to put that in the description below. You can just click on that and check out the form if you do want to go ahead and apply. Now, these Extra Help programs, the eligibility criteria is determined, of course, by your income and your resources. So if you're living on a fixed income, this might be a great option to pursue. Now, the way these Extra Help programs is a little bit variable because it depends upon your Medicare Part D plan. And Medicare Part D plans are different. They're offered by different carriers. For example, some carriers may choose to waive the deductible entirely, while others are going to involve that deductible that's set by the federal government. So if you have a deductible, then the Extra Help program will help you to pay towards that. But if you don't have a deductible, obviously, it's not going to help pay towards a deductible that you don't have. However, Extra Help programs will help to put a cap on your prescription drug costs. So in 2021, if you're enrolled in an Extra Help program, you cannot be charged more than $3.70 for a generic drug and more than $9.20 for a name brand drug that's covered by your plan, of course. There are actually some additional options if you want to look into prescription drug cost savings. For example, there are state pharmaceutical assistance programs and pharmaceutical assistance programs. I know the names are almost identical, but they're actually different things. So state pharmaceutical assistance programs are run by the states, and you can find out if your state participates in one of these programs on Medicare.gov. That's Medicare.gov. However, I do want to warn you that actually, sadly, most states don't participate in these types of programs. But if your state does, there's a great cost savings. Then there are pharmaceutical assistance programs. Now, some pharmaceutical companies do choose to offer their prescription drugs, a limited supply of them, at no cost to individuals that meet certain criteria. There are websites where you can search the databases and find out exactly which these drugs are. And I will put a link to some of those websites in the description below. Of course, there are other ways to make Medicare more affordable if you're living on a fixed income. We've got a video all about those common Medicare mistakes and how to avoid them, and I will put that in the description below as well. Basically, you need to stay informed. Enrolling on time will help you to avoid late penalties, which are an absolutely frustrating way to waste money on Medicare. Additionally, we highly recommend that you work with a broker. Specifically, you want to work with a licensed broker. And if you're looking to cut costs, we'd recommend working with a broker that isn't going to charge you for their services. And yes, they exist. We are amongst them. A broker is a third-party liaison who is an expert in their field who works for you, not the insurance company. A broker can help present you with a myriad of different options that you may not have even known was available to you. And basically, when you can pick the right plan that matches your needs, you're definitely going to cut down on some of those extraneous costs. So if you have any questions, like I said earlier, please feel free to leave them in the comments below, or you can give us a call here at iHealthBrokers at 888-410-0344. Like I said, licensed brokers and no charge for our services. If you liked this video, please make sure to click like and subscribe as well to stay up to date on all things health insurance. And if there are any other videos you'd like to see, let us know in the comments below. Thank you so much. Have a great day. Bye-bye.